Can we have Dr. Neha with factors affecting visual outcome after SFIL implantation in aphakic patients? Doctor, I think you are in this podium, Dr. Neha.
Hello, good afternoon, everyone. Thank you, AIS, for giving me time to present my paper on factors affecting visual outcome after SFIL implantation in aphakic patient. I have nil financial interest and none conflict of interest. Now, coming to introduction, as we all know, the definition of aphakia is absence of lens, and the main etiology are iatrogenic, trauma, and congenital. In congenital, it can be primary or secondary. The main management of aphakia are non-surgical and surgical. In non-surgical, we have aphakic spectacles, contact lens, and in surgical, on the basis of PC status, it can be sulcus placed IOL, AC IOL, iris fixated IOL, or sclera fixated IOL. Now, coming to objective of my study, it was to assess the visual outcome after SFIL implantation in aphakic patients and factors affecting visual outcome. It was a non-randomized retrospective clinical study and was conducted after taking institutional ethical committee permission. The study adhered to the tenets of declaration of Hensky. The parameters that were noted in pre-treatment findings was the etiology of aphakia, best corrected visual acuity, keratometry readings, intraocular pressure, and any other secondary ocular pathology other than aphakia. In treatment, intraoperative complication and time elapsed since surgery. In post-treatment, residual refractive error, haptic status, lens centration, keratometry readings, intraocular pressures, and complication. The standard surgical procedure was, all procedures were performed by a single operating surgeon. Taking aseptic and antiseptic precaution, 270-degree peritomy was done. Toric marker was used to mark diametrical opposite ends. The scleral pocket dissection was made using a crescent. 1.5 mm behind the limbus sclera entry was made with a 23-gauge retinal blade, and foldable multi-piece IOL was put either through limbar or sclerocorneal groove. It was externalized using SFIL forceps and haptics were fixed. The peritomy was closed. Now, coming to results from January 2020 to December 2022, a total of 36 patients underwent SFIL implantation by a single surgeon in our center, out of which 2 patients on operating table were found to have subclinical RD and were excluded from our study. Now, coming to demographic characteristic, the mean age of the patients were 44.5 plus minus 20.48. The range was from 7 to 74 years. Male-female ratio was 2:1, which was non-significant. Also, the eyes, right eye was 20 and left eye was 14. The mean follow-up periods in months were 11.5 plus minus 4.2 months. Now coming to aphakia etiology, it was iatrogenic in 44.1% and due to trauma in 55.9%. The best corrected visual acuity in pre-op was 1.73 plus minus 0.24 in logMAR, which significantly improved from day 1 to 6 months. Now, coming to complication analysis, during intraoperative complication, we have IOL-related complication in 2 patients in which haptic broke during operation, and hyphema and retinal break were also present in few patients. Now, coming to immediate, the most common complication was transient corneal edema, which was 23.5%, and raised intraocular pressure in 26.5% patients. There were other complications also like vitreous hemorrhage, hyphema, and now coming to early post-operative complication, it was IOL decentration was found in 8.8%, and pupil abnormalities like traumatic mydriasis were found in 6 patients, and none patient had macular edema. Now coming to late complication, we have haptic related complications in 8.8% patients, like suture haptic exposure. Corneal decompensation was noted in 5.9%. The main complication in late period were secondary glaucoma in 11.8% and astigmatism was in 32.3%, that is nearly 1/3 of the patient. Now coming to discussion, when compared to other studies, our studies showed more incidence of transient corneal edema. It may be due to poor endothelial count. In our study, there was no incidence of hypotonic choroidal detachment or endophthalmitis as similar to other studies. In long term, the most common complication was due to astigmatism. My conclusion is the final visual outcome in SFL implantation depends both on anterior and posterior segment pathology. The outcome also depends on etiology of aphakia, whether it is iatrogenic or traumatic or any other ocular pathology. My take-home message is whenever an SFL implantation is planned, along with thorough anterior and posterior segment examination, patients should be made well aware of outcomes and complications that can be encountered immediately or in long term. These are my references. Thank you.
Okay, thank you.
You said that you looked into factors associated with outcomes, but that in the results you didn't show any factors that were...
Because we have less patients, we cannot get half of the patients nearly were iatrogenic or traumatic. When we will compare, we did not have sufficient samples to classify them.
Thank you, Dr.